The country is today marking National Doctors' Day, and that's to recognize the growing challenges that they face on a daily basis. The Health Department is also embarking on a two-day primary healthcare conference in East London to reflect on and review the country's journey towards the ideals of primary healthcare. Over 350 delegates will attend the conference from all 9 provinces. Stakeholders in the sector also representing local and international organizations and the World Health Organization. Let's speak about all of this with Dr Jennifer Nash, a specialist family physician working in the Amatole district in the Eastern Cape. And Dr Nash, it's lovely to have you on the program. Thank you so much indeed for making time. I wonder if we can begin by just placing the significance of this conference and how you would describe what even the primary healthcare approach to care is.
Good morning, and thanks very much. Good morning to all your listeners as well. So you're correct, the Primary Healthcare Conference is happening in East London, and it's an amazing opportunity to network and to start discussing the challenges facing primary healthcare. So currently primary healthcare should be the heartbeat of healthcare. It should be where healthcare happens. We should connect with people in their homes. And so this conference is really starting to discuss how do we reorientate our healthcare system so that we are able to achieve universal health coverage. And universal health coverage is really about all people being able to access the full range of services that they need when and where they are at no financial hardship. And that's obviously a huge challenge at the moment. So this primary healthcare conference is starting to discuss how do we start thinking around that for South Africa. And currently our healthcare system is very hospice-centered. And so it's really about flipping that around and saying, how do we start looking at communities? How do we get more people into communities to work? So around rehab, about people with disabilities, about mental health. And so we recognize that our health system tends to rely on people coming to the door. And that means that some people don't actually ever access healthcare. And so universal health coverage is about flipping that around and saying we need to be able to be in people's homes, in the communities, making sure that the full range of services are there.
Sure. And how do you begin doing that? And I suppose you'll answer that in just a moment. Part of the question, though, is whether or not we do have countries, maybe even regions in the country, that are successful at doing what you've just outlined.
Yes, and we're very fortunate to have some countries represented, even here at the conference, which is a huge privilege to be able to learn from other countries. We know there are some amazing examples. One that comes to mind is Rwanda, where just in 1994 they faced a huge genocide, and yet they've been able to flip their health system around through very strategic leadership and by partnerships and by concentrating on primary healthcare. And their infant mortality rate is actually slightly better than ours at the moment in South Africa, although they invest slightly less GDP towards health. So South Africa is in a very privileged position. We invest about 8.6% of our GDP towards healthcare. So we have the opportunity to really be able to make a difference. But it really calls for some strategic leadership and for everyone to be on board. And that means communities, organized labor, our doctors, our nurses, our rehab teams. It really calls for partnership. And I think that's what this conference is really starting to understand, that we need everyone. And we realize at the end that's going to realize our goal.
Yeah, absolutely. Speaking about leadership and collaboration, when you speak about universal healthcare, many people think about NHI, which, let's face it, has become an incredibly politicized issue in this country. To what extent has that complicated your ability to have honest and frank conversations about where this will work and where it won't?
So I think it's a really good question, and I think what people need to understand is that universal health coverage is a system that must be implemented. It's going forward. NHI is really a financial model as to how that's going to be realized. But we can't. There are NHI discussions that are going on, but we can still start practicing universal health coverage. It's all about providing equity, making sure that there's continuity of care, that a patient is cared for, community is cared for through their life course. That includes palliative care at the end of life. So we mustn't be daunted by NHI and all the political discussions. That's the financing model. But the actual health provision is going to come through universal health coverage. And community-oriented primary care, COPC, those are the the working blocks of providing healthcare. And that's what us clinicians and our partners and surrounding stakeholders should be concentrating on.
Yeah. You speak about us not being bogged down by what's happening politically. And I wonder how possible that is. We've seen, for instance, the direct cause to effect about how a lack of political leadership leads to hospitals, for instance, not working as they should, and that driving out specialist doctors from these public hospitals who, quite frankly, are moving not because they want to, but they feel like they've been left with no other option. They don't have the most basic tools of their trade. And I wonder, because the conference has already started, whether you get a sense that there's at least an acknowledgement of that from representatives of these political heads who are in attendance at that conference.
So I think yesterday in the opening address, there were a number of delegates, both political leaders who certainly did present the problems and acknowledge the problems. There was also opening address by WHO Africa region, and also discussions from environmental health, human settlement, SALGA, and I think there's increasing recognition that health can't do this alone, that we need a lot of stakeholders to meet together. I think we also just need to remember about the ARV program and recognizing that in the late 1990s and early 2000s there was a tremendous need for antiretroviral therapy to be rolled out. And yet there wasn't the political commitment and the leadership. And yet currently now in South Africa, we have the largest antiretroviral program in the world. And so it just shows what civil society and what doctors and nurses and advocates can do by proposing and advocating for a changed system. And so I think that's on World Doctors Day. That's the message of hope that we need to bring forward. We need a new system. We need, as you've mentioned, there's so many challenges. The challenges with water. Just even this morning, I read something about slates being cancelled, theatre being cancelled because of water outages. So the thing is that we all need to raise our hands and start working together. And perhaps healthcare workers have become a bit complacent. We feel we've got our antiretrovirals, but there's still a lot of work to do. And so that's why we need to rise up together and actually start advocating for a new system.
Yeah, and not to labor the point, but I find it so ironic that this conference is being held in the Eastern Cape because the former health ombudsman in this country, Professor Malekapuru Makgoba, described the Eastern Cape Health Department as an embarrassment. So if we're looking for examples, I suppose, about where things could improve, right where the conference is at, some people might argue.
Absolutely. But alternatively, you could argue, isn't it great that more people in the Eastern Cape have access to the conference? Because if it was in a different province, it would be a lot more expensive and inhibit people being able to be there. So perhaps if you're going along your line of reasoning, Eastern Cape need to hear these words and be there. And so perhaps it's an amazing opportunity for people to actually be a part of the conference and network and see some of the showcase. Many good practices are being showcased. There's 6 tracks, and so people have a wide range of talks to attend, ranging from social determinants of disease to digitalization, IT, right through to a quality improvement project. So it's a great opportunity to perhaps immerse more people in some best practice.
Yeah, absolutely. Look, it'd be naive for any of us to believe that all these issues would be ventilated and, in fact, resolved within the 2 days that this conference is sitting. But I wonder, from your perspective, what you reckon would be the mark of a successful conference at the end of the day?
That's a good question. You can talk about numbers. Do you do a tick box? Do you say how many MECs were at the conference? I think the real conference is really just a tiny part of really work that happens. And I think the challenge is that every single person at this conference needs to go back, and even if they have 2 or 3 action points, they need to start discussing with their teams how do they implement some of these things. And so sometimes in some of the discussions that we were in yesterday, it was really about in your facility looking at what kind of audits can you do to improve the system. And maybe it's as simple as saying in my casualty, there's chaos. All I need is to put some in boxes to organize the files so that I can see which patients are more urgent than others and improve the triage system. And so I think we sometimes wait for outside people to come in and do a fancy quality improvement project. But every single time you make a decision, it's actually an improvement project. So if you're facing traffic when you go to work, you don't do the same route every single day. you check Google, and that's a quality improvement cycle. And so I think if everyone could go back from this conference and just pick on one or two things, and recognizing that everyone is a leader in your sphere of influence. And so we need to stop waiting for top management to make decisions. We need to start being leaders. We need to care for our clinicians. We need to show empathy. We need to smile. We need to have far more cups of tea with colleagues to actually hear where they are. And we need to work across the cadres. And so we need to recognize that a cleaner, a general assistant in a hospital is just as important as perhaps the most A-rated scientist or the professor. And we need to start forming those teams. And perhaps COVID broke down some of those teams. And so we need to go back to the basics of making sure we know about people and care for each other. And from that, we will be able to care for our patients much better. There's a lot about resource, austerity measures. And there are a lot of ways that we can start working smarter, looking at how we orientate the health system, be far more efficient. We need to put people where the workload is and not just have facilities running with lots of staff with no patients. And also just around, prescribing practices. There are a lot of things that we can actually do to make things far more efficient.
Yeah,
and
absolutely.
I think that's really where everyone,
Yeah, we spend a lot of time thinking about what's taking place in Gaza, especially at Al-Shifa Hospital, where doctors are adamant that they're going to stay beside their patient, even though their own lives are at risk. And I suppose on this National Doctors' Day, that reminds us of the resolve of the human spirit, and I suppose the sentiment you've just shared, being able to continue with the job at hand despite the circumstances in which you work. So Dr. Jennifer Nash, thanks for your time. Really do appreciate it. And I suppose happy National Doctors' Day to you too. Dr. Nash is a specialist family physician at the Amatola district in the Eastern Cape.